Welcome back, Kelly. How are you?
I'm good. How are you?
I am well. So, today in our fireside chat, I thought we could talk about your on demand training, Sitting in the Darkness, Embracing the Full Range of Human Emotion.
Yes.
Yeah.
Yes, this was a training I'm really passionate about as a therapist myself, and more importantly, as a supervisor, really seeing the need for understanding and acknowledging emotional pain in the session. I think this training goes really in depth to the importance of not wanting to just rushing to fix a
Mhm.
client or no, not rushing to fill silence and really giving clinicians the understanding and the evidence behind why sitting with difficult emotions is super important.
Yeah, absolutely. I think sometimes it's so hard to kind of sit with those big things that come up as therapists and not take them home. So I always like to ask about, as therapists, like, yes, we have the training curriculum and how to support our clients, but kind of what is something that you want clinicians to take away for their own relief from burnout, or as I like to call it, that crispiness that happens with a lot of trauma narratives?
Yeah, I think that burnout or crispiness is something that is happening because we care. We build relationships with these clients. And so when we are experiencing deep emotional pain in session, it's really hard to just clock out and go back to our regular life because we care. We are thinking about these situations. And so, really encouraging clinicians to use supervision or consultation and inviting appropriate people into that space for our own help is really important, and really understanding that we're not going to help anyone unless we help ourselves first as well.
Absolutely. And I think one thing when I was reading through kind of your course description, which I probably should put, say here. So this course studies the effectiveness and acknowledgement of negative and painful feelings, especially on clinical outcomes as a whole. So in this training, your goal is to really have participants be able to increase comfortability using a realistic approach to human feelings and experience while effectively challenging, reframing, and refocusing kind of techniques. So, with that in mind, I guess my question for you next is kind of what or how are you kind of bringing that into the therapy room? Like, what are some of the things, maybe the highlights that you want the therapist to take home to be able to use in session?
Yeah, so I myself as a therapist am a huge fan of cognitive challenging. I always joke that, I love to challenge my clients over and over and they come back for more and they love it. But really when I was delivering this training and researching this training, understanding the need not to challenge always and to just
Mhm.
sit. So I named it Sitting in the Darkness because we need to be with our clients through their pain and not always be the person to challenge them or to make them feel better. I think it's instinctual sometimes to disagree with a client who's describing painful feelings about themselves. Our instinct is to disagree with them or to be like, no, everything is okay, you're doing this, but that's invalidating. And so understanding that validating a client's pain is going to make them feel seen and heard for maybe the first time, and how important that can be and how strengthening of the therapeutic relationship that can be too.
Absolutely. So, can you maybe share maybe about a time in your kind of therapeutic work that, and without client details or
Of
anything,
course.
where you kind of were able to lean into this discomfort that the client shared, and there was maybe a shift kind of in the outcome or in that session or in that relationship?
Yeah. Yeah, I think that some lots of examples come to mind, and all of them kind of center around a client experiencing or expressing a great deal of emotion or a great deal of trauma in that moment. So a trauma could look like grief of a loved one, grief of a child, perhaps. And understanding in that exact moment, there's nothing that I can do to make them feel better, and to lean in and sit. And so using some nonverbal movements or soft eye contact, head
Mhm.
nodding, and really just being able to feel that pain in that moment gives the client the time necessary to absorb what was just said. And so
Mhm.
sitting in that darkness is also allowing the client and the clinician to absorb the impact of what they're feeling.
For sure. I'm just thinking kind of from my own, client caseload, past and present, kind of the beauty of when maybe you are sitting in that dark place with the client, and then the client kind of looks at you and they're like, oh, this doesn't feel as heavy, or oh, that sounded like really harsh. Like that
Mhm.
maybe sounds like too much. That's not really how, and then there's that conversation of, okay, yes, I thought I was feeling this. In that moment, I was feeling this. But now that I'm looking back, like, maybe that's not the full picture of what I'm feeling or
Yeah,
sensing anymore. Like now that I've said it out loud, there's a different thought that's arising. Uh,
yeah,
so-
absolutely. And giving respect to the person,
Mm,
really understanding the dignity and the worth of that individual person.
absolutely. Um, so I know we always like to talk about like what you would want kind of participants to take out of this training. Is there a different, maybe a different question? Maybe it's what you hope for that therapist like leaving this course on demand. Is there something that you are wanting them to do that maybe shifts their mindset or helps them to feel different or think differently from a clinical perspective? Anything of that nature?
Yeah, I think a large goal for the participants or the people who come to this training would be to not be afraid and to understand they're going to have a lot. It's a 3 hour course, a lot of knowledge and a lot of evidence based and um, specific, like specific case example experience as well of not to be afraid of going into that darkness and realizing that there's so much clinical opportunity and space for healing that if we don't just try to work from a strengths based approach and we're really just focusing on what the client is bringing to session, that it's not something to be afraid of. And it's actually a really powerful and great opportunity to build alliance with our clients and to allow them to have a space that they don't have in any other part of their life to
Mm,
just sit with some things that are really, really difficult. So increasing feelings of ability, really.
lovely, lovely. So to sign up for this on-demand training, where would one go to do that?
One would go to the on demand tab of our website at embodiedtraininginstitute.org. So we have all of our on demand courses there. You can peruse around and see maybe what other offerings we have. Our goal for the Institute is to really build our on demand
Mhm.
content a lot throughout the year. And so you could find sitting in the darkness, understanding and acknowledging the need for emotional pain in session, I believe. Yes. So many words. You can find it there and sign up there. And there's all the reading and the requirements and the post test and everything there in one easy place.
Wonderful. Well, thank you so much, Kelly, for talking to us about this new offering on demand.
Thank you.
You're so welcome, and we'll come together again soon.
Awesome. Bye.